In this video, we will be discussing chronic somatic dysfunction. TART is used to assess somatic dysfunction, and for boards, you should know what TART stands for and be able to differentiate between acute and chronic TART findings. T is tissue texture changes. A is asymmetry. R is restriction. Note that a restrictive barrier lies before the physiologic barrier. And the second T is tenderness. In our video here, we will be focusing on chronic findings of TART. To represent chronic, an older dog is depicted here. Although asymmetry is present in chronic dysfunction, the body has made compensations, making asymmetry less obvious, so the dog is laying relatively flat. The dog is confined to a house, which represents restriction, but there is no shock collar. This should remind you that although restriction is present, there is decreased or no pain present. The relaxed posture of the dog should remind you of tissue texture findings that can include flaccid or decreased muscle tone. The fibrotic ropey tissue texture is represented by the rope he is holding in his mouth. The dog is dry inside the house to represent the lack or decreased edema and cool, dry skin often found in chronic somatic dysfunction. The fireplace represents the burning sensation, and the dull pencil represents the dull tenderness that can be felt in chronic somatic dysfunction. These are the TART findings for chronic somatic dysfunction. Be sure to watch the video about acute puppy to learn the TART findings for acute somatic dysfunction.